Namaste. I'm making this video today for anyone who's ever asked me about knee issues or knee problems. And this is a yoga stretch action you can do for your knees that my teacher who certified me, Lex Gillen, taught me was the only therapy ever known to man in a yoga style form of movement. So there's going to be a block we're going to use. You can use a very firm blanket rolled up several times, stacked, or a pillow that's very firm, but you want to just operate with great care and trust that this kind of action on your knee will bring therapy to most knee problems. And again, it's the only movement or stretch or position I've ever been taught that delivers therapy to knee issues. So I'm going to start sideways to show you the sideways version. There is a split between muscles in the back of our calf, and you're going to want to take your thumb in between those two muscles sort of and draw down and separate a little bit as you move your leg back. So we're going to start by sitting in staff pose with both legs out in front of us. You can take your hips behind you a little bit with a nudge to help really sit up properly on the sitting bones. And again, I'll do the full version and then I'll show you some variations for your level of flexibility. But I actually have a bad knee on my right. My kneecap is shifted and it can be adjusted by my chiropractor who helps me put it in alignment. But I do struggle with some issues that I have on my right knee, so I use this for myself and it greatly helps. I can personally testify. So what you're going to want to do after staff pose is, if we're going with the right leg first, lean on your hands deep to the left, gently pull your thigh up and gently pull your foot behind you. Now, you will remember maybe when we were little kids and you would see kids with both their legs in this position watching TV with their foot turned out, and you might remember parents or people saying that's so bad for the kid's knee. Well, that's because of the ankle. So you're in yoga, you're going to always want your foot to be perfectly flat behind you, all toes touching the ground. And that might not happen right away, so that's where you're going to want to use a block and lift up. But again, for this first position, I'll show you exactly how it's done and then some modifications. So you lean far to the side. It's called bifurcating that muscle in the back. Draw it out with your thumb. Pick your body weight up with the weight of your hand, with the strength of your arms and hands pushing into the ground, and scoot yourself over into that pocket in between the ankle or the heel and the hip, and you're going to want to make it so you can hardly get your hand in between the two. That's how close you want to be with your hip to your heel. Sitting straight up, you want to try to have both sitting bones on the ground at this point. Again, checking to make sure that the foot is not curled in or tucked in or curled out or tucked out. You want it perfectly flat and straight as much as possible. Sitting still, you might just stay here for a while. And this is actually not twisting your knee. It's putting some therapeutic stretching on it to take pain away. Anything out of alignment will actually be put back into alignment, like my kneecap. And I do have some pain and some crunching sounding that happens whenever I walk upstairs or do a lunge when I work out. And so this really greatly helps it and is so much therapy for it, just sitting like this. And then you're going to want to slowly walk back onto your hands a little bit as you get your flexibility going through the front of your thigh, hip flexor area. And then maybe go down to your elbows, sit there for a while, try to tuck your tailbone underneath your body, keep that foot flat as possible, all toes on the ground, and then try to work towards laying all the way down. Again, push your elbows and your body weight into your arms, tuck the tailbone, try to rest down in this position without letting the knee fly up. You want to try to keep it grounded and stay here. You can keep your hands on your belly or above your head and really stretch. Lots of energy in the straight leg, pushing through the ball of the foot and the heel at the same time, and breathing and stretching. Push body weight into your elbows to come up safely, one at a time, scooting back up to sitting tall. And to get out of it, you want to lean deep, far to your left, gently take hold of the back of the thigh, and remove the leg slowly back up to a sitting staff pose. Now, if you don't have the flexibility for that, that's where you're going to want to grab something stable and put it underneath your leg, or your hip, your sitting bone of your right foot. For this pose, when you're propped up, I like to have a kneeling position on the other leg. Lean deep to your left and take that leg behind you. Now, this is where it gets tricky because you don't want to feel a twist in your knee. You just want to feel a nice stretch. So I kind of shimmy around until I don't feel any danger there. I try to get my hip, again, as close to my heel as possible, all toes on the ground. Then I straighten out this leg and slowly walk back. I'm not going to go much farther than this because this is going in a direction where we feel like there's not much flexibility in that particular person's body. If you want to try to go all the way down to your back or your elbows in the supported position, you're going to want to have something under both hips or both sitting bones. So again, if you have a prop underneath just one, you're not going to want to go very far back because I like to have both sitting bones even and at the same level. But this will at least start to get your leg used to stretching in that way. So I'm going to lean deep to my left to remove the block and that position. So again, put a prop under both hips if you're really, really starting out, then under one, and then slowly work your way to the ground. Let me know if you have any questions by posting below this video, and I hope it really helps your knee. Namaste.